Welcome to our comprehensive guide on antiretroviral drugs, essential for managing and treating HIV. Living with HIV can be challenging, but understanding the tools available to combat the virus can empower you to take control of your health. In this video, we'll delve into the complex world of antiretroviral drugs, breaking down their mechanisms of action and shedding light on how they work together to keep the virus at bay. This guide is designed to be informative and accessible to everyone, regardless of your medical background. We'll use clear language and visuals to explain the science behind these life-saving medications. Whether you're newly diagnosed, living with HIV, or simply want to expand your knowledge, this video will provide you with a solid foundation on antiretroviral drugs. Nucleoside reverse transcriptase. Inhibitors, or NRTIs, are often referred to as the backbone of HIV treatment. But what exactly does that mean? And how do they work? Imagine a virus as a machine trying to make copies of itself. This machine has a specific part, an enzyme called reverse transcriptase, which is crucial for its replication process. NRTIs act like a wrench thrown into this machine's gears. Think of it this way. When HIV attempts to multiply, it needs to convert its RNA, the blueprint for making new viruses, into DNA. Reverse transcriptase is the key enzyme responsible for this conversion. NRTIs, being similar in structure to the building blocks of DNA, can sneak into this process. However, there's a catch. Unlike the regular building blocks, NRTIs are like incomplete pieces, missing a crucial component. When incorporated into the viral DNA chain, they halt further construction. It's like building a wall and suddenly encountering a brick with no mortar. You can't go any further. This interruption of DNA synthesis effectively stops the virus from replicating, preventing it from spreading further in the body. This mechanism of action makes NRTIs a cornerstone of HIV therapy. They're often combined with other antiretroviral drugs to form a powerful treatment regimen, effectively suppressing viral replication and allowing the immune system to recover. While NRTIs are generally safe and effective, they can have side effects just like any medication. These side effects vary depending on the specific NRTI, but may include nausea, fatigue, or more rarely, more serious issues like lactic acidosis or liver problems. It's essential to remember that everyone responds to medication differently. Your doctor will consider your individual health needs, potential drug interactions, and other factors when choosing the right NRTI for you. Now let's talk about another class of antiretroviral drugs that also target reverse transcriptase, but in a slightly different way. These are the non-nucleoside reverse transcriptase inhibitors, or NNRTIs. If you recall, NRTIs work by disrupting the construction of viral DNA. NNRTIs, on the other hand, adopt a more direct approach. Imagine an enzyme like reverse transcriptase as a lock, and the NNRTIs as keys designed to fit into that specific lock. Once an NNRTI binds to reverse transcriptase, it essentially jams the lock, preventing it from functioning correctly. This binding doesn't directly stop the enzyme from working, but instead changes its shape or conformation, making it less effective at its job of converting viral RNA into DNA. This disruption of the enzyme's activity significantly hinders the virus's ability to replicate. NNRTIs are potent drugs, and when combined with other antiretroviral medications, can effectively suppress HIV replication to very low levels. This suppression is crucial for improving immune function and slowing the progression of HIV. Like all medications, NRTIs can cause side effects, which can vary depending on the specific drug. Some common side effects include rash, headache, and gastrointestinal issues. In rare cases, NNRTIs can cause more severe side effects like liver problems or allergic reactions. Your doctor will work with you to determine the best treatment plan, taking into account any potential risks and benefits, as well as your individual health history and other medications you may be taking. They will also monitor you closely for any side effects and adjust your treatment if necessary. Moving on, let's explore protease inhibitors, or PIs, another crucial class of antiretroviral drugs that plays a vital role in suppressing HIV. To understand PIs, we need to delve a little deeper into how HIV replicates within our bodies. Imagine a virus as a complex puzzle. Before it can infect new cells, all its pieces need to be assembled correctly. One of the final and crucial steps in this assembly is the work of an enzyme called protease. HIV protease acts like a pair of scissors, meticulously cutting long chains of viral proteins into smaller, functional units. These smaller units are essential for the virus to mature and become infectious, capable of infecting other cells. This is where PIs step in, effectively disarming the virus during its final stages of assembly. PIs work by binding to the HIV protease, blocking its action. Think of it as gumming up the scissors, preventing them from making the necessary cuts. As a result, the virus can't assemble itself properly, producing immature and non-infectious viral particles. These incomplete viruses are incapable of infecting new cells, effectively halting the spread of the virus within the body. PIs, like other antiretroviral classes, are rarely used alone. They're typically combined with other antiretroviral drugs, creating a powerful synergistic effect that suppresses HIV replication to very low levels. While generally safe and effective, PIs can cause side effects like nausea, vomiting, diarrhea, and increased cholesterol levels. In some cases, they can also contribute to insulin resistance and body fat redistribution. Your doctor will monitor you closely for any side effects and adjust your treatment plan if needed. Remember, it's crucial to discuss any concerns or side effects you experience with your healthcare provider to ensure you're receiving the most appropriate and effective treatment. Now let's shift our focus to a relatively newer class of antiretroviral drugs called Integrase Strand Transfer Inhibitors, or INSTIs. These medications work by blocking a critical step in the HIV replication cycle, the integration of viral DNA into the host cell's DNA. To understand this, imagine the host cell's DNA as a vast library containing the genetic blueprint of the cell. For HIV to establish a persistent infection, it needs to insert its own genetic material into this library, effectively becoming a permanent resident. The enzyme responsible for this insertion process is called integrase. Integrase acts like a microscopic surgeon, cutting open the host cell's DNA and inserting the viral DNA. This integration is a crucial step for HIV because it allows the virus to hijack the cell's machinery and produce more copies of itself. INSTIs act by binding to integrase, preventing it from carrying out this integration process. They effectively block the virus from inserting its genetic material into the host cell's DNA. Without this integration, the viral DNA cannot take control of the cell's machinery, and the production of new viruses is halted. INSTIs have become an essential part of HIV treatment due to their high potency, favorable side effect profile, and ability to rapidly reduce the amount of virus in the blood. Like all medications, INSTIs can cause side effects, but they are generally well tolerated. Some common side effects include headache, fatigue, and gastrointestinal upset. In rare cases, INSTIs can cause more severe side effects like liver problems or allergic reactions. Your healthcare provider will consider your individual health needs and potential drug interactions when choosing the right INSTI for you, if appropriate. They will also monitor you for any side effects and adjust your treatment plan as needed. Moving on, let's discuss entry inhibitors, a class of antiretroviral drugs that work by preventing HIV from entering the host cells in the first place. Think of our cells as heavily guarded fortresses with specific entry points that require the right key. HIV has evolved to exploit these entry points, using them to gain access to the cell's inner workings. Entry inhibitors, as their name suggests, are designed to block these entry points, effectively shutting the virus out. To understand how they achieve this, we need to look at the two main subclasses of entry inhibitors: fusion inhibitors and CCR5 antagonists. Fusion inhibitors target the first step of HIV entry, which involves the fusion of the viral envelope with the host cell membrane. Imagine the virus as a spaceship attempting to dock with a space station. The viral envelope is like the spaceship's docking mechanism, and the host cell membrane is like the space station's docking port. Fusion inhibitors act like barriers, preventing the spaceship from attaching to the space station. They bind to the viral envelope proteins, preventing them from interacting with the host cell membrane, thus blocking the fusion process and preventing HIV entry. CCR5 antagonists, on the other hand, target a different entry point. HIV uses a co-receptor on the surface of our immune cells called CCR5 to gain entry. CCR5 antagonists act like decoys, binding to this co-receptor and blocking HIV from using it as an entry point. By blocking these different entry points, Entry inhibitors effectively prevent HIV from gaining access to the host cells, halting the infection process in its tracks. Entry inhibitors are often used in combination with other antiretroviral drugs, especially in cases where the virus has developed resistance to other classes of medications. Like all medications, entry inhibitors can cause side effects. Some common side effects include injection site reactions for fusion inhibitors, and headache, fatigue, and gastrointestinal issues for CCR5 antagonists. Your doctor will help determine if entry inhibitors are right for you based on your specific circumstances and will monitor you closely for any side effects. Let's now explore maturation inhibitors, a unique class of antiretroviral drugs that interfere with the final stage of HIV's life cycle, viral maturation. We've previously discussed how HIV uses protease to assemble itself correctly. Maturation inhibitors target this process, but instead of blocking protease directly, they work a bit differently. Imagine a factory assembly line where a product, in this case new viral particles, is being built in stages. Maturation inhibitors act like saboteurs on this assembly line, disrupting the final steps of assembly and rendering the finished product defective. They achieve this by binding to a specific viral protein called GAG, which is crucial for the proper assembly and maturation of new viral particles. GAG acts like a scaffold, holding everything together and ensuring the virus matures into an infectious form. By binding to GAG, maturation inhibitors prevent this proper assembly, leading to the production of misshapen and non-infectious viral particles. These defective viruses are unable to infect new cells, effectively halting the spread of the virus. Maturation inhibitors, while a relatively new addition to the antiretroviral arsenal, offer a unique mechanism of action and are particularly useful in treating individuals who have developed resistance to other classes of HIV medications. Like all medications, maturation inhibitors can cause side effects, but they are generally well tolerated. Some common side effects include injection site reactions, headache, and gastrointestinal upset. Your healthcare provider will assess your individual needs, potential drug interactions, and other factors when determining if a maturation inhibitor is appropriate for you. They will also monitor you closely for any side effects and adjust your treatment plan if needed. Now, let's talk about a group of medications that are not antiretroviral drugs themselves, but play a crucial role in enhancing the effectiveness of other HIV medications. These are pharmacokinetic enhancers, more commonly known as boosters. To understand boosters, imagine you have a team of athletes, each with their own strengths and weaknesses. Boosters are like the coaches or trainers who help these athletes perform at their best by optimizing their training regimen and providing them with the necessary support. In the context of HIV treatment, the athletes are the antiretroviral drugs and the coach is the booster. Boosters work by increasing the concentration of certain antiretroviral drugs in the bloodstream, making them more effective at suppressing HIV replication. They achieve this by inhibiting the enzymes responsible for breaking down these antiretroviral drugs in the liver. This inhibition allows the antiretroviral drugs to stay in the body longer and at higher levels, maximizing their impact on the virus. Boosters are often used in combination with protease inhibitors and some other antiretroviral drugs to enhance their effectiveness, especially when lower doses are desired or when there are concerns about drug interactions. While boosters themselves do not have any direct antiviral activity, they play a vital role in optimizing HIV treatment by ensuring that the antiretroviral drugs are working at their peak performance. It's important to note that boosters are not typically used as standalone medications, but are always prescribed in conjunction with other antiretroviral drugs. Your doctor will carefully consider your individual treatment needs, potential drug interactions, and other factors when deciding whether to include a booster in your HIV treatment regimen. Let's now delve into post-attachment inhibitors, a relatively new class of antiretroviral medications that work by interfering with HIV's entry process after the virus has already attached to the host cell. Imagine a thief attempting to break into a house. They've managed to pick the lock and attach themselves to the doorknob, but they haven't quite made it inside yet. post-attachment inhibitors act like a security system that activates after the thief has attached themselves, preventing them from entering the house. In the case of HIV, the thief is the virus and the house is the host cell. HIV initially attaches to the host cell through a specific receptor called CD4. Once attached, HIV needs to engage with a co-receptor, either CCR5 or CXCR4, to gain entry into the cell. Post-attachment inhibitors work by binding to the CD4 receptor on the host cell after HIV has already attached. This binding blocks the interaction between HIV and the co-receptor, preventing the virus from fusing with the cell membrane and entering the cell. Essentially, post-attachment inhibitors trap the virus on the surface of the cell, preventing it from completing the entry process and establishing infection. This mechanism of action makes post-attachment inhibitors a promising addition to the antiretroviral arsenal, especially for individuals who have developed resistance to other classes of HIV medications. While post-attachment inhibitors are generally well tolerated, they can cause side effects like other medications. Some common side effects include headache, fatigue, and gastrointestinal upset. Your healthcare provider will determine if a post-attachment inhibitor is appropriate for you based on your individual circumstances and will monitor you closely for any side effects. Finally, let's explore attachment inhibitors, a class of antiretroviral drugs that target the very first step of HIV's entry process, attachment to the host cell. Imagine a lock and key mechanism. The lock represents the CD4 receptor on the surface of our immune cells, and the key represents the GP120 protein on the surface of the HIV virus. For HIV to infect a cell, the GP120 protein must first bind to the CD4 receptor, like a key fitting into a lock. Attachment inhibitors work by blocking this initial binding step. They act like a fake key, fitting into the CD4 lock on the host cell and preventing the real key, the GP120 protein on HIV, from attaching. By blocking this initial attachment, these inhibitors effectively prevent HIV from taking the first step towards infecting a cell. Without this initial attachment, the virus cannot proceed with the subsequent steps of entry and replication, effectively halting the spread of infection. Attachment inhibitors are a relatively new addition to the antiretroviral drug arsenal and offer a unique mechanism of action, making them a valuable tool in treating HIV, especially in cases where the virus has developed resistance to other classes of medications. As with all medications, attachment inhibitors can cause side effects. Some common side effects include injection site reactions, headache, and gastrointestinal upset. In rare cases, they can cause more severe side effects like liver problems or allergic reactions. Your healthcare provider will carefully consider your individual health needs, potential drug interactions, and other factors when determining if an attachment inhibitor is right for you. They will also monitor you closely for any side effects and adjust your treatment plan if needed. Thank you for watching our guide on antiretroviral drugs. We've covered a lot of ground, from understanding the different classes of drugs and how they work, to the importance of adherence and the potential side effects. Remember, knowledge is power, and understanding your treatment options is crucial for effectively managing HIV. This video serves as a starting point for your journey towards understanding antiretroviral therapy. It's essential to remember that everyone's experience with HIV is unique, and treatment plans are tailored to individual needs. Always consult with your healthcare provider to determine the best course of treatment for your specific situation. Stay informed, stay proactive, and stay healthy.